Hi, Dr. Ahmed with the Brain and Spine Institute. In this video, we're going to talk about a direct lateral interbody fusion, otherwise known as a DLIF. Now, please keep in mind that these videos are meant for the patients being treated at this practice. These videos are just a generalization, and each patient's outcome and experience may vary. The surgery starts off by placing the patient in a lateral position, meaning that they're laying on their side, and I've drawn a table to indicate such. So while the patient is laying on their side, fluoroscopy or x-ray is used to identify the appropriate levels, and an incision is made either on the left or right side. This tends to be a surgeon preference depending on the curvature and anatomy of one's spine. Once the incision is made, dissection is made through the skin, subcutaneous tissue, making sure that we don't cause any damage to the organs, and ultimately dissection is made down to the spine. Once the surgeon has approached the spine, we have to be very careful to make sure that we don't cause any injury to the nerves. You can see that there are nerves running off to the side of the spine and they go down into the legs. On the side of the spine, there is a large muscle here called the psoas muscle. The psoas muscle is involved in hip flexion, and there are several nerves that are going through the muscle going down to the spine. As we are approaching the spine, we have neuromonitoring techniques to ensure that there's no nerve injury. Once the surgeon is at the level that needs to be treated and the muscle has been dissected and we've confirmed that there is no nerve injury, the surgeon will begin by removing the disc. A knife is used and several instruments are used to remove the disc in its entirety. Once the disc is removed, a cage is placed in the spine. By placing a cage in between the vertebrae, that restores the height of the spine, and it will actually unpinch the nerves that may be causing the symptoms. Once the cage is in place, sometimes it is covered with a little plate and screw that provides stability to the construct. After the incision on the side is closed, sometimes surgeons will also make tiny incisions in the back of the spine and put screws in the spine and connect them with a rod, similar to the previous videos that we have on the website. Through the small incision on the side, numerous levels in the lumbar spine can be treated. The length of surgery really depends on how many levels the surgeon is treating. After surgery, it is common that the hip flexion movement is impacted because of the muscle dissection off the spine. However, with therapy, it returns back to normal. Patients are usually in the hospital 1 to 3 days after surgery. They get to wear a back brace they're going to wear when they're up and about out of bed. Ultimately, you'll come to the office at 2 weeks where your incision will be checked, and then physical therapy will start. Physical therapy will continue for approximately 2 months, and then usually by the end of month 3, patients have recovered back to their baseline. Patients are usually cleared to start driving anywhere from 2 to 4 weeks after surgery, and the same goes for work.